course, one of the most common questions that I get is, help me to better understand the medical treatment of tinnitus. Well, in order to answer this question, we have to take a step back. To understand tinnitus, we have to start to understand the why. Why do people have it? Why do they live with it? And what can be done about it? Now, let's start out with a definition. How do we define tinnitus or tinnitus? The definition is really pretty simple. A phantom sound heard in either the ears or somewhere in the brain. But let's stop right there before we go any further. A phantom sound. I love that definition. You know why? Because the use of the word phantom is intentionally analogous to phantom limb. Now, with phantom limb, it is typically described as a perception or a sensation or some sort of a pain in a missing extremity. But in both of these, phantom limb and phantom sounds, it's most often that it occurs where there's a disruption of the neural signals from the peripheral system up to the central system, or from ear to brain. Now, let's get back to tinnitus. When we think of the cause of tinnitus, whether it be the ringing, the hissing, the swishing, the buzzing, whatever the sound may be, the sounds that the patients are actually hearing is the neural consequence of the hearing loss. Now, I'm not saying that every form of tinnitus is because of hearing loss, but it is estimated that over 90% of tinnitus have associated hearing loss. Now, if you really want to know the other 10%, they're most often associated with some sort of a dental or mandibular issue, perhaps even intracranial pressure. But if you look at the numbers, there are 50 million people in the United States that report tinnitus. Now, if that number sounds familiar, it probably should. There are also 50 million Americans that also suffer from hearing loss. Now, you can do the math, and I don't think that it is coincidence. So, given that tinnitus is actually the neural consequence of hearing loss, you would think that everybody with tinnitus has a significant hearing loss. And that's not necessarily the case. There are a lot of people with normal hearing that have tinnitus. But we can't forget that research tells us a loss of 50% of neural connections from ear to brain can be found in people with normal hearing. Pretty crazy. So, even when someone says that they don't feel that their hearing has been affected, doesn't mean that the nerves from ear to brain are not breaking down. When nerves are compromised from ear to brain, ringing can result. Just like when the nerves are compromised from arm to brain, a person gets a fault sensation or pain that they perceive in their arm or leg. Now, going back to that analogy, let's focus on the medical treatment of hearing loss and how we need to approach this problem. Now, as usual, let's start out with the why. So, why do we treat tinnitus? Well, there is no cure. However, there are plenty of medical conditions that don't have a cure, but they have very effective treatment rates, just like treating tinnitus. So today's treatment, when it is set correctly, can reduce ringing in 70 to 80% of patients. Now, how long that takes really does depend on the patient, and it's very important to lay out that this is not a quick fix. In fact, studies have shown that changes and adaptations made in the brain can be made in just a few minutes. We've had patients that have said in the office, wow, this ringing is gone as soon as we started the treatment. But it can also take months, maybe years or longer. And we need to be upfront and how important it is, regardless of how long that it takes. And that is the most effective treatment because the alternative is really doing nothing. But this is not acceptable. We all need to understand that hearing loss is a progressive degenerative disorder and if left untreated, can lead to all sorts of problems like dementia, stress, anxiety, hospitalization, increased risk of falls, and even premature death. So it is really important that we start treatment early. Now, this is the how. How do we treat tinnitus? Well, when it comes to treating tinnitus, the goal is to provide the auditory biological feedback that the brain needs. With this stimulation, you encourage neuroplasticity, and when dealing with the hearing loss, there is a major loss of neural connections. Though through treatment, the goal is to target the remaining nerves so that you can maintain that quality and that vitality of the system. Otherwise, they're going to be the next in line to go. The brain will need to take time to adapt to the stimulation in order for the patients to experience a reduction in his or her tinnitus. Now, what do we do? With our patented neurotechnology treatment process, we are able to treat each patient individually. Now, it is a custom treatment plan that is laid out for each patient depending on the individual hearing loss and cognitive needs. These are both qualitative and quantitative assessments that are required to measure the success of treating tinnitus. Now, these are all part of the neurotechnology process, and we have nearly an 80% treatment rate with this process. Remember, with targeted stimulation accompanying cognitive behavioral techniques, we can help to drive down that ringing for all of our patients, therefore helping everyone live their best life. Thank you and take care.